Examination of shoulder joint. Shoulder joint की examination. A special feature of shoulder joint. It is mainly formed by two joints, glenohumeral joint यानी कि shoulder joint proper and the scapulothoracic joint. Once more, it is mainly formed by two joints, glenohumeral joint and scapulothoracic joint. The dislocations are common as ball head of humerus is bigger than the cup glenoid. Okay. Approach to patient कैसे करेंगे? Proper history taking first, then expose both shoulder, third inspection, then palpation, then movement. Later we will take measurement and do some special test. What we will ask in history? The pain, onset and duration. In acute case, trauma. Subacute, chronic is because of infection. Associated with fever, if history is there, then condition was the infective condition. Associated with movement, abduction done for supraspinatus, internal rotation for subscapularis. In your exam, if they will ask you abduction association with movement, in abduction we will test supraspinatus, internal rotation subscapularis. If radiation was cervical radiculopathy, radiated pain, cervical radiculopathy. Associated aggravating and relieving factor, movement, रेस्ट, एनाल्जेसिक, किस चीज़ से उसको रिलीव होता है? स्पेस्मोडिक पेन इंक्रीज विथ मूवमेंट, स्पेस्मोडिक पेन विल इंक्रीज विथ मूवमेंट. बोन पेन इंक्रीज विथ मूवमेंट, स्पेस्मोडिक पेन increase with movement, bone pain increase with movement, with or without movement. Then swelling, acute or gradual swelling, progressive or not. In acute onset trauma, because of swelling is because of trauma and other reactive effusion in TB and synovitis cases. In stiffness we will ask single movement, supraspinatus tear, global movement, adhesive capsulitis. Instability, in instability we will see single side mostly due to dislocation and global neuromuscular involvement. ठीक है. Then in past history we will ask with the patient, do you have diabetes? Because in diabetes frozen shoulder is most common. Hypertension, neurological disorder like epilepsy, hematological disorder or TB, because in epilepsy dislocation will occur. Shoulder exposure, expose both shoulders so that we can compare them. Shoulder inspection, inspect the patient and see. Attitude in which he keep limb. Attitude can be abduction, anterior dislocation में abduction होगा. Adduction, attitude will be adduction in posterior dislocation, abduction and dropping in deltoid paralysis. Contour of shoulder, if lost, then anterior and inferior dislocation, anterior inferior dislocation maintained, then posterior dislocation. Swelling, if localized swelling was there, then it is because of bursitis or dislocated head. Localized, generalized is because of effusion. So muscle wasting, muscle tear off, rotatory cuff, nerve localized या generalized, Skin over shoulder, any scar, sinus, previous surgery mark was there or not. Shoulder palpation, confirm finding seen in inspection. Local temperature, compare with opposite side. Infective pathology, tenderness, anteriorly sternoclavicular joint, clavicle, acromioclavicular joint, acromion and spine of scapula. Start again from base of neck towards superior aspect of shoulder and down laterally 1 to 4 cm below acromion for biceps tendinitis. In lateral aspect, sulcus sign, inferior dislocation. Posterior aspect, any soft tissue swelling or edema. Medially, pulsation of axillary artery can be checked. Shoulder movement, active or passive. For active, patient himself attending all movement. If bony pathology, muscular pathology, neurological pathology, patient might not be able to do some of the movement. And for passive, by examiner, patient sit on a stool, examiner one hand on a scapula and other holding flexed elbow. Movement, primary muscles and supporting muscles. For flexion, 0 to 135 degree. Primary muscle is pectoralis major, clavicular part, anterior fiber of deltoid. Supporting muscle, coracobrachialis and short head of biceps. For extension, posterior fiber of deltoid, latissimus dorsi, and supporting muscle is teres major, triceps long head, pectoralis major, sternocostal head. Abduction, pectoralis major, latissimus dorsi, long head of biceps, short head of biceps, teres major and coracobrachialis. And for abduction, supraspinatus 0 to 15 degree, deltoid 15 to 90 degree, serratus anterior and trapezius 90 to 180 degree. Medial rotation, pectoralis major, anterior fiber of deltoid, latissimus dorsi, teres major. Supporting muscle is suprascapularis. Lateral rotation, posterior fiber of deltoid, infraspinatus, teres minor. Circumduction, it is combination of all movement. Shoulder movement, different measurement are length of arm, angle of acromion to tip of lateral condyle, mid-arm circumference, a point from tip of acromion, anterior and posterior axillary fold to be measured, discrepancy, dislocation of shoulder joint. Shoulder special test, painful arc for supraspinatus, subacromial bursitis, drop arm test, complete tear of rotatory cuff, palsy of deltoid, lift off test for subscapularis, Gerber's test. Test of infraspinatus and teres minor external rotation, apprehension test for dislocation, comprehension test to detect instability, dropping test for infraspinatus muscle, Hawking-Kennedy test, test for impingement.